The seventh commitment is that I will give Americans more control over and access to health care with affordable and portable free market solutions. This is the future. This is the future of how you reduce the cost of health care and increase the quality of health care. The future is not socialized medicine. This will be a defining issue in this campaign. Every one of the Democrats wants government-mandated health insurance. It is going to lead to government-controlled health insurance. And we have to go in exactly the opposite direction. We have to go in the direction of private-controlled health insurance. America's solutions to problems are not big government and big institutions. America's solutions to problems is a free market. And the way you accomplish that is a very big tax deduction so you can purchase your own health insurance. A health savings account so you can put money aside. Health vouchers to help people who cannot afford health insurance, to help them buy health insurance so that health insurance is portable. Eliminate Medicaid fraud and eliminate frivolous lawsuits because it is adding so much to the cost of medicine we can't even measure it. We can't measure the cost of a doctor being worried about being sued for malpractice and ordering 2 or 3 more tests that are not necessary or 1 or 2 more opinions that aren't necessary. Nobody, absolutely no one can blame the doctor for doing that. His livelihood and his reputation is on the line. If anybody can question anything he does, even unfairly question it. But do people realize how much that adds to the overall cost of health insurance? Because it's not an accountable system. It's a system out of control. So here's very briefly how this would work. You would have a $15,000 exemption from taxes to go buy your own health insurance. Don't have to get it from your employer. Don't have to get it from the government. You go buy your own. $15,000 tax-free money. If you can find a $9,000 policy for you and your family, you get to keep $6,000 in tax-free money. That's the incentive. That's what will move people toward the private market. When you all move toward the private market, the insurance companies will start to create insurance policies and products that are cheaper, more effective, higher quality, because they'll see with the large number they can make a much bigger profit than they're actually even making now. And they will increase quality because you'll be monitoring them. You can get it down to a $9,000 policy. You have $6,000 for your regular medical expenses. You can have a health savings account for up to $6,000. Then you can just start to decide, this is what I can afford every year for health purposes. I don't need insurance for it. Because I have this tax-free money, I can afford $100, $1,000, $2,000, $3,000, $4,000. Years you don't spend it, you get to keep it. Years that you do spend it, you're spending tax-free money. And whatever you don't spend builds up in your retirement account. And then we have an America in which 100 million people are going out and making choices. That's the way you reduce cost. That's the way you increase quality.